Telemetry can be helpful during a patient's hospitalization to monitor for arrhythmia, ischemia, or QTC changes that could be impactful to the hospitalization. However, overuse of telemetry in patients can also lead to unnecessary tests, time loss, and wasted healthcare dollars. Oftentimes, telemetry is ordered by an admitting team, but the physician may not regularly check it. Telemetry can also be a burden for patients. Carrying around a cardiac monitor on their gown throughout the admissions can affect mobility. The American Heart Association has published guidelines to standardize telemetry usage, including the indications for telemetry use and duration of monitoring. To improve appropriate telemetry use within our hospital and residency program, we implemented several initiatives to match these guidelines. The purpose of our project is to reduce inappropriate use of telemetry, with my primary focus on improving telemetry usage among the medicine residents. We collaborated with the nursing floor managers, telemetry technicians, attending physicians, and medicine residents to brainstorm ways on how to increase awareness of how telemetry is being used. Our first intervention was use of a telemetry discontinuation protocol, for which nurses can encourage the discontinuation of telemetry for their patients if they had no cardiac events. The next intervention was posting telemetry tracking sheets for physicians to review, in which telemetry technicians can write names of patients who had been in normal sinus rhythm for over 48 hours. The portion of the project I primarily focused on was increasing our residents' usage of the telemetry tracker on our EMR system. This also included a short lecture to encourage residents to be more cognizant about how telemetry is being ordered and reiterated the purpose of telemetry use. To assess the value of our intervention, several days a week we collected the number of patients on telemetry and calculated the percentage of those patients who were on telemetry for over 48 hours. We compared these percentages before and after each of our interventions. Our results have found that there was a decrease in the telemetry use over 48 hours after each of our interventions. The most dramatic change was following the implementation of the normal sinus rhythm tracker sheets, which decreased telemetry use from 45.7% to 39.7%. Resident engagement also decreased the percentage of telemetry use over 48 hours, but only decreased from 39.7% to 37.1%. Our intervention was found to be helpful in appropriately reducing our telemetry usage. However, resident engagement can be a focus for improvement. A recent survey conducted within the residency program demonstrated that only approximately half the residents check telemetry daily for their patients. Our EMR system has a couple columns that can be selected to be reviewed that provide easily accessible data about patients' telemetry use. Within our program, only 5% of our residents use the column that includes telemetry order start date, and only 10% uses the column that signals whether telemetry use has been more or less than 48 hours. These results may illustrate that residents are not regularly checking telemetry on patients, or may not be aware on when it should be discontinued. In addition, resident turnover every year may be contributing to the decreased telemetry monitoring. Longitudinal interventions within the residency program would be helpful. Currently, we are developing a handout for residents to refer to that can help guide their decision on telemetry use. The hope is that these handouts can be easily accessible to the residents so they can get into the habit of recognizing appropriate telemetry use. Thank you.